Hello, welcome to Leadership Live with Anton Gunn. It's a pleasure to be with you today. And did you know that February is Heart Health Month? Now, there are a lot of months in a year, and there are a lot of celebrations that happen each month. It's also Black History Month in February. But heart health is something that I want to talk about this morning. And that is, the question is your leadership style affecting your team's health, particularly your team's heart health? Now, I know you might think that everybody is their own person and their own lifestyle and their own diet and exercise routine is what affects their heart health more than anything else. But I want to dispel you of that notion today, that your role as a leader, how you lead your teams, what environment you set, the environment that you create can have a disproportionate impact on your team's health. Now, I'm going to give you an example of what do I mean, the impact on your health, because it's not just the health, it's also on the bottom line of the team. I literally was with some friends this weekend, and I was sharing a story about a nursing leader that I knew in the past. This leader played an incredibly important role on her team at a hospital. I'm not talking about a low paid person. I'm not talking about a person that people diminish in their professional capacity, that she was skilled at her job, even had a PhD. But because of the environment that the leadership created for her, this person had significant stress. It even took her out of work for 12 weeks on FMLA. Now, I know some of you don't know what FMLA is, but for all my leaders, you know what FMLA is. It's the Family Medical Leave Act. It's the law that allows people to take paid leave that you can't replace them. You can't get rid of their job. You can't hire somebody else in their place, and they're gone for 3 or 4 months. Now, I want you to think about your current team right now. Is there anybody on your team that you could afford to lose for 3 or 4 months and not replace them? That their work is so insignificant that you don't need them for 3 or 4 months? I will tell you this. I don't care what role they play. If they're on your team, if they have a job in your organization, you cannot have that person missing for 3 or 4 months. Somebody is going to need to do that work over that time frame. And the people who are left behind to do that work are going to be significantly overburdened, overwhelmed, overworked, and then they're going to burn out or have stress or have heart challenges. So let me tell you this circumstance. This person worked in an area of the hospital called discharge planning. Now, when I say discharge planning, when people get admitted to the hospital, they might stay 1 day, they might stay 2 days. But when the doctor says you can go home now, they don't just let people get up out of the bed and go home. They have to plan for their discharge. They have to set the time of day for that person to discharge. They also need to make sure that they have prescriptions, or that they have someone to come and pick them up, or that they have all of the medical tools and the resources at home to take care of them at home so they can recover fully. Because the worst thing you want to have happen is somebody to be discharged and then within 30 days, they have to come back to the hospital because they're not getting better or they're not getting worse. Now, this is not a medical conversation, but I needed to set up for you the importance of discharge planning. Let me give you an example of the impact of discharge planning. The hospital stays can be very, very expensive. If you've ever stayed overnight in a hospital or had anybody that stayed overnight in a hospital, you know that it can be very, very expensive. As a matter of fact, when my wife was pregnant with our daughter and went into labor on Christmas Day. And we were at the hospital, not only Christmas Day, but for the 2-day stay in the hospital because my daughter wasn't born until the day after Christmas on the 26th. When we discharged, we had more than an $8,000 medical bill for a 2-day stay at the hospital. 2 days. Now, that's just to have a baby. But imagine if you were in a hospital for a double bypass or some kind of knee surgery or some other major medical issue. It's expensive for you to be in the hospital. So the important part is that it's not just expensive for you, it's also expensive for the hospital because they have to pay staff to take care of you, right? So every day that someone stays in a hospital longer than they need to, it's going to cost a lot of money. So when you go home, they want you to stay home. They don't want you to be in the hospital. They really don't want you there because they would want to take care of sick people. But if you're well enough to go home, they don't want you in the hospital. And if you're in recovery, they want you to fully recover. Now, I'm framing all of this up because this particular nurse leader was on the discharge planning team. And I'm going to just say discharge planning because I'm going to use that term because you will understand it. There's some other terms like utilization review and social work and nurse case management that I know you won't understand. And that's right. I see Valerie say she stayed 2 nights for a surgery and the bill was $59,000. The insurance paid most of it, but she had to pay $5,600 out of pocket. That's a lot of money. Okay, so let me set this up. This nurse leader who worked in case management, that worked in discharge planning, was working in a highly toxic environment with a highly toxic leader. Now, her job was instrumental because her job was to make sure that every patient that went home had all of the tools, resources, and necessary to take care of themselves at home. So she made a lot of phone calls to community partners. She even had ramps built in people's houses because if they came home in a wheelchair, they needed to be able to get in the house and maybe they had a porch with high steps and didn't have a ramp. So discharge planners make sure you have all of those tools to be able to get home. Have all of those tools to be able to get home. So this person's job was incredibly important. They sometimes would order durable medical equipment like oxygen machines and other things to make sure people had these things at home. So her job was critical to helping you to go home to be healthy and safe, or your loved one to go home and be healthy and safe after they had a major hospital stay. Okay, that's her job. Now, this leadership environment that she was in, the leader was toxic. I mean, when I say toxic, this leader was a horrible human being, didn't deserve to be in leadership. But, you know, as I've always said, sometimes when you're a screw up, you move up. They don't get rid of screw ups in some organizations. They just move them up into higher positions. Well, this screw up was put into a leadership position over the discharge management team or the discharge case management utilization review team. This leader was horrible. She made all kinds of circumstances difficult for this particular nurse leader who had a critical job. And it got so bad that this nursing leader was stressed every day at work. Before she would start her day, she would sit in her car and cry in the parking lot before she went into the office. She cried before work and didn't want to go in, but knew she needed her job. And so she went into work. And the days were so hostile at work. And I don't even need to add in the part, but I know some of you probably are thinking it. She was the only person of color on her team. And when I mean the only person of color, she was an African-American woman working for a team that was all white. Now, race had a dynamic in this, but it wasn't the only dynamic. This leader was just a bad leader. So she would cry in the car. She would come to work and start to do her job. But they would isolate her. They would leave her off of emails. They would CC other people to try to embarrass her, to make her look bad. They would do all kinds of things to hurt this person's reputation in the workplace. Not only that, this person had a PhD. So she was a doctor working in case management, doing an amazing job, but her bosses did not have a terminal degree. her bosses did not have as much education she did, and they were intimidated by that. So they intentionally would disrespect her academic credentials. Now, academic credentials are not unimportant, but they are important. If you earn them, particularly in the healthcare work environment, they're important. So I don't want to get distracted by the point. I want you to know that they made it really hard for this person. This person started to gain weight. They started to have so much stress on them that literally her hair started to fall out in clumps because she was having that level of stress. And when she came to me about this whole environment, I told her, well, the first thing you need to do is you need to go to the doctor and get some help. You need to get some medical care. Like, I don't care what's going on at work. We can't fix the work problem until we make sure you're alive and that you're healthy. And so she went to a doctor, and the doctor understood the circumstances and what she was dealing with, and literally explained to her that her level of stress was causing her all of these other side effects, and that he didn't know if she was going to have a nervous breakdown or have a heart attack. But either way, the physician prescribed for her that she should be out on medical leave for 12 weeks. So for 12 weeks, this woman went home to rest because of the work environment that she was in. Now, here's what I want you to understand. I just asked you, do you have anybody on your team that could be out of work for 3 whole months and you be able to manage the workload with a person being gone for 3 whole months? You can't backfill it. You can't bring somebody else in to do their job. You cannot replace this person's position according to the law. Now, some people do it, but they ain't doing it the right way. But is there anybody on your team who you could lose for 3 whole months? But more specifically, think about it like this. If you're the leader who created a toxic environment for this person, and the only reason they're out is because of stress, you can't afford to lose that person. But you know, if you lead in this way, you're probably creating an environment that you're always going to have somebody out on your team because of stress and because of health, and maybe it's their heart health. Now, I know some organizations who literally, this employer had about 7,000 employees. They had an average of 900 people out per day on FMLA. Now, some of them were legitimate because, they had a major surgery they needed to be out. Others, they had a baby, something along those lines. Like they're supposed to, be out because they're sick and ill. But there are about 10% of that number who were not really sick. They weren't physically sick, but they were sick of working in a toxic environment with toxic people who mistreat people in the workplace. They were sick of working there, but they didn't have another job. Now, why am I sharing this with you? Because I want you to know that the American Heart Association knows that stress in the workplace is a massive contributor to poor heart health, that people will have heart attacks. I think you've heard me talk about the story of the woman who worked for Wells Fargo Bank, who was working in her cubicle all weekend. And then 4 days later, when she didn't show up at work, people didn't know why she wasn't showing up at work. And come to find out, she died sitting in her cubicle. She was dead at work for 2 days and nobody saw her. Dead for 4 days and nobody saw her. Her body was keeled over in a cubicle at work and nobody at the workplace saw her. Can you imagine that? That you are so stressed at work that you die at work, or that your coworkers don't even know you're missing. All of these things are horrible to hear about. There are other stories of people dying from stress in the workplace, particularly in the financial services industry. It's really, really bad. The stress and the pain, and the stress and the anxiety with managing money and the hours that you got to pull if you're on Wall Street. These things impact heart health. So today, I want to help you as a leader to understand it is your job to help you stay healthy. So I'm going to talk about 3 questions that I'm going to ask of you and then give you something to do to make sure that you are managing your team's health. 3 simple things. This won't be long today at all, but I needed to lay out for you the pain and the problem of not making sure that your team is healthy and making sure you don't have a leadership style that keeps people unhealthy in the workplace. So here's the first question that I want to ask you. Do you encourage rest and recovery on your team? Now, when I say encourage rest and recovery, do you tell your team to take breaks? Break during the day, break during the week, that if you have a busy season, so for instance, if you work in television, okay, TV might seem like a low stress industry, but it's not when there's this thing called sweeps week. And that in sweeps weeks, I know that they don't allow people to take days off doing sweeps. Like you can't take a day off this week because this is about us getting the most eyeballs on TV, getting the highest ratings to be able to generate the biggest ad dollars so we can fund our budget for the full year. So you can't take days off during sweeps week. But my question for you, when sweeps week is over, do you encourage your team to rest and recover, to take time off? In healthcare, there's a lot of pressure to not take time off because we need to take care of these patients, that our health is secondary to the health of the patients. So I'm asking you as a leader, do you encourage people to take breaks, take time off? Do you make sure that people are using their vacation days? Like we all know someone who carries over lots of vacation days every year because they never take them. That's not a good thing. So as a leader, you need to encourage people to take breaks, to rest and recover, to take their vacation days. I can give you an example of a company who thought that rest and recovery was so important that if you took a vacation, not a one-day vacation, but if you took a week-long vacation at this company, the company would pay you $7,500 bonus for taking a week's worth of vacation. But if you didn't take the week's vacation, you lost the $7,500 bonus. How about that as an incentive? That a company is going to pay you to take vacation. So what am I telling you to do? I'm telling you to check in every quarter with your teammates, the people that you lead, and ask them, what's your plan for vacation this year? I'm just checking in to make sure that you're going to take your full vacation days this calendar year. And if they tell you, hey, I like to save mine up until December and then take off 2 weeks in December, that's cool too. Let them do it the way that makes the most sense for them. But what you don't do is allow them to go a whole year and not take days off. Rest and recovery is critical. That's the first thing, is encourage rest and recovery. Now, the second thing is this. Do you manage conflict effectively on your team? Because if you work in a high stress, highly complicated, highly matrix industry like healthcare, even retail, IT, the tech sector, imagine working in aviation right now. It is high stress in general. So those people definitely need to rest and recover, but also there's going to be conflict in the workplace. So how do you handle conflict as a leader? Are you doing a good job of being fair and transparent with people when there's a conflict? If you're not fair and transparent, if you don't know how to handle conflict, you're going to create an environment where the stress level is going to raise, that people will beef in the workplace. Colleagues do have conflict. They do fight, not physically fight. Let's hope not that, but there will be massive disagreements. And you as a leader, if you don't intervene, if you don't get in the middle of it, if you don't find a way to be fair and transparent in how you mediate that conflict, if you avoid it, if you just like let it happen and don't try to do anything about it, you're going to create a higher stress environment. an environment where people might explode. Like what I found in my research is that these incidences where physical violence breaks out in the workplace, it breaks out at work when there's a leader who is absent from intervening, or a leader who hasn't created a culture where other employees can intervene, because you can't see everything as a leader, but you should have people on your team who know that this is unacceptable. This conflict is not working. This is not healthy. And they either bring it to you or you have equipped them to intervene to de-escalate situations. So the question is, are you managing conflict effectively? Do you even know how to manage conflict effectively? My call to action to you, if you don't know how to manage conflict, or if you don't know if you're doing it right, or if you feel like when you get in the middle of it and you try to manage it, it bubbles back up again, then you probably need to take a course, hire a coach, get a consultant to help you to learn how to manage conflict. Conflict resolution is critical. I got a colleague of mine, her name is Siobhan Arline Bradley. She loves conflict. Not love conflict in that she wants to create it, but she has expertise in intervening in conflict. She wants people to raise their disagreements. She wants people to talk about their disagreements. She loves to help manage and address conflict and get people to a better place. You might need somebody like that. I can help you manage conflict, but again, there might be some higher experts that you should consider. So that's the second thing is, are you managing conflict effectively? There's a final thing that I want to give you today, okay? And this is really around how you can improve the heart health of your team. The third question for you, do you reward and recognize your team members? Now, some people might think, what does reward and recognition have to do with managing heart health and keeping my team heart healthy? Because when people do a job and they work hard and they perform and they hit their goals and they hit their measurements and they help the team be successful, if they don't get a thank you, resentment can start to build up over time. Anger can start to build up over time. Negative energy can start to build up because you have not said the two most important words in the English language, and that is thank you. So you got to do better at acknowledging people, acknowledging their contribution to the organization. Be thoughtful about saying thank you and showing gratitude to the people on your team. Rewards and recognition doesn't necessarily mean you got to have a program every week or every day, but you should shout people out, call them out for doing a good job. Thank them for doing what they do best. It also means celebrate the wins. Here's an example of how you can celebrate the wins. If you have a tough month or a tough week or a tough quarter and you hit your goals and everybody wins, take your team out to lunch. If they're not all in the same place and some of them were remote, we'll find out their favorite restaurant and send them all a $25 gift card to their favorite restaurant. If you got a team of 10, it might cost you $250. But as a leader, it's better to spend $250 by sending everybody in your team a $25 gift card than it is to have one person out for 3 months, because that's going to cost you a whole lot more. So there you have it. 3 simple things. Encourage rest and recovery on your team. Number 2, learn how to manage conflict. And number 3, reward and recognize the people on your team. If you do that, you're going to create a positive environment. You're going to an environment where people can manage their heart health. You're going to create a space that people feel like you're walking the walk and talking the talk at the same time. And if you want a bonus thing, lead by example. Manage your own heart health. Make sure you take breaks and you rest and recover. Make sure that you don't cause conflict. Make sure that you always reward and recognize your team, and make sure that you get some daily exercise and do the things that you need to do to be healthy. I want to thank you for watching this episode of Leadership Live with Anton Gunn. We will see you next Wednesday at 9 a.m., same bat time, same bat channel. Everybody have a fantastic day.